How do beta-3 receptors impact bladder health? Imagine your bladder as a balloon that needs to stretch and relax to hold urine comfortably. Beta-3 receptors are like tiny switches in your bladder muscles that help control this process. These receptors are mainly found in the muscle layer of the bladder called the detrusor muscle, as well as in the lining known as the urothelium. When these receptors are activated, they cause the detrusor muscle to relax during the filling phase, which means your bladder can hold more urine without feeling urgent. This relaxation is important because it helps prevent the frequent, sudden urges to urinate that many people experience with overactive bladder. Activation of beta-3 receptors increases the production of a chemical called cyclic adenosine monophosphate inside the muscle cells. This chemical signals the muscles to relax, allowing the bladder to expand and store urine more effectively. When the bladder can stretch without involuntary contractions, symptoms like urgency and frequency decrease. Interestingly, activating these receptors does not interfere with the bladder's ability to empty when you go to the bathroom. It helps improve storage without causing problems during urination. Beyond muscle relaxation, beta-3 receptors also seem to influence the nerves that send signals from the bladder to the brain. When stimulated, they can promote the releases of substances like nitric oxide, which helps calm nerve activity that might otherwise cause overactivity. This dual effect on muscle and nerve signals makes beta-3 receptor activation a helpful way to manage bladder symptoms. Medications called beta-3 agonists, such as Mirabegron, are approved treatments for overactive bladder. They work by selectively activating these receptors, leading to increased bladder capacity and fewer involuntary contractions. These drugs are often preferred because they tend to have fewer side effects compared to older medications that block nerve signals, like antimuscarinics. From a bladder health perspective, using beta-3 agonists helps improve quality of life by reducing the discomfort and inconvenience caused by overactive bladder symptoms. It's important to note that current research shows no evidence linking beta-3 receptor activity or these medications to the development or worsening of bladder cancer. Their main role is to support healthy bladder function and symptom management. In summary, beta-3 receptors play a vital role in maintaining bladder health by helping the bladder store urine comfortably and reducing overactivity. Medications targeting these receptors are effective and safe options for managing bladder dysfunction, but always consult a healthcare professional for personalized advice and treatment options.